This video is an overview of the skin of the palm, where you will find several types of epithelium and connective tissue. I'm going to turn the annotations off because you can see those when you study on your own. So the first thing I'm going to do is to zoom in on the covering epithelium of the skin. And that is stratified squamous keratinized epithelium. The keratin is present in all this reddish pink stain stacked of cells that contain only keratin. All the organelles, nucleus have been dissolved and lost, and so they're just bags of keratin. But the living part of the epithelium is down here. These are live cells, and you can see their nuclei. You can also get an idea of their size, because that bar is 50 microns. So if we take 1, 2, 3, divide into 3, it's about 15 microns in diameter. That's what that nucleus is. You see how the cells are stacked here. They're undergoing mitosis down here. So anyway, that's the epithelium. Under that is loose connective tissue. Do you see how thin the collagen fibers are? And the cells here are fibroblasts. And there's a lot of space. Some of it is shrinkage space. Other is filled with ground substance. Because remember, connective tissue is composed of cells, fibers, and ground substance. So that's loose connective tissue. Now, if we move down below that, you will see the collagen fibers are much thicker, like this one. And they're arranged in an irregular fashion, going in different directions. So that's a dense, irregular connective tissue. And you still have fibroblasts. That's a nucleus of a fibroblast here, scattered throughout, because those are the cells that maintain those collagen fibers and produce them in the first place. And then the next over here is a duct. And actually it's a longitudinal section of a sweat gland duct that has 2 layers of cells, seen best right here, stratified cuboidal epithelium. You can find other examples of that down here in the sweat glands. Here are stratified cuboidal-lined sweat gland ducts, and over here are secretory cells of the sweat gland. And then down below that, in the in the below layer, or the subcutaneous, because you see, technically speaking, the dermis here and the epidermis is skin, and then we have the subcutaneous or subskin area, and this whole complex of tissue here is called the integument. But here you have white adipose tissue cells, multilocular adipocytes forming adipose tissue. And way down here we have an artery with a branch. We're not studying that right now, but you can look at the lining of the artery, which are very flat cells with flat nuclei. Those are simple squamous epithelial cells. Okay, so you need to spend time with this, as well as when you finally have studied all these specimens in Module 1, you should go to the outside resources and even use Google, or look up on the internet and search for the different types of epithelium. So that finishes this overview of the integument specimen in Module 1 lab.